like to tell you my story. Since my early days as a clinician, I felt uneasy whenever a patient with neck pain entered the room. This was unlike the other patients I treated, and I wondered why. And therefore I wondered, why is it that I'm not helping my neck patients as well as I may help in my knee, hip, and shoulder patients? In 1999, I wrote my master's thesis at the University of South Australia on active treatments for neck pain. I then realized that the neck region was very different to other regions of the body in its neural complexity. Multiple connections exist between the neck, the eyes, and the vestibular system in the inner ear, which make it harder to solve this problem without relating to these connections. Many patients fail to recover due to traditional mechanical approaches to neck pain. I learned more about the capacity of the problem of neck pain and realized that it affects over 30% of Western population that suffer from this problem every year. A main factor that is affecting neck pain is modern lifestyle with prolonged sitting and lack of physical activity. In addition, the number of car accidents is increasing rapidly, and therefore the incidence of whiplash injuries is also on a constant rise. In emergency rooms in UK, it was reported that the incidence of whiplash injuries has risen dramatically from 7.7% to 57% in less than 2 decades. However, this is not just a serious health problem. It causes a heavy financial burden on Western society. The cost of neck pain in the US is estimated to be around $17 billion a year. In Europe, not too far from that, $13 billion. So what do we do with that huge, costly problem? Then my nationality comes in. It was only once I returned to Israel that I found the solution, or at least part of the solution. I discovered virtual reality, and this idea was born. Virtual reality introduces to us an interactive, motivating, and pain distraction environment. And what we were seeking is to integrate all those 3 systems I told you about, and therefore motion tracking with the gaming, a playing scenario, gave me the idea to start this system. Here's a short demo of our system. In a small screen, you can see what the patient sees inside the head-mounted display. So as the patient moves her head, we also collect motion data regarding her neck motion, and therefore we can analyze this motion and see and diagnose the capacity of the impairment of her movement abilities, being the range of motion, the velocity of motion, her smoothness. And then we found in research that these parameters are closely related to the symptoms of the patient and his functional disability. I continued to investigate the area, and we performed a 3-phase clinical study. The findings showed that we have an objective, reliable, and diagnostic method, which is essential when you want to develop a medical device. But in addition, a more striking findings is that we found a significant therapeutic effect compared to conventional methods, being that patients who interacted within this scenario improved and enhanced their mobility more than when they used just conventional instructed voluntary motion. And this is a significant point because we know from research that there's a difference when someone voluntarily moves his neck to when he's just responding spontaneously to an external cue. And these are all motor learning principles that we knew before. Physical virtue introduces an advanced diagnostic and therapeutic solution supported by clinical research. Our solution is suitable for clinical use, so the clinician can diagnose and measure the impairment in the clinic And then it is also adaptable for home or work use. So the clinician can actually modify the parameters and tailor a program for training, provide a set for the patient, and he takes it home or work, or whether it's on his iPhone application, and he can train many times a day and therefore improve his pain, walk through his pain, and get rid of the mechanical problem as well. We do have prospects for additional breakthrough solutions to serious health problems, all dealing with motion impairments. And I'd like to finish with a personal tone. I became a physiotherapist after a severe injury I went through, and my aim in life ever since is to help others recover and get over with their pain and continue to function regularly. This methodology presented to you here is capable to help millions of people out there suffering from neck pain. Thank you.